Good morning, everyone. Today on Perspectives, we're hearing from our Brothers Keepers, the people who serve our homeless. Here's one definition of homeless: an individual or family who lacks a fixed, regular, and adequate nighttime residence. The last year, in 2018, more than 500,000 people in our nation were experiencing homelessness on a single night. Now, that's about 17 out of every 10,000 Americans. Most are individuals. White men are the largest racial group. 33% of our homeless are families with children. Now, this morning we'll hear from 6 different servant organizations who will get their assessment of homelessness in our area, how they're serving, and how much success they're seeing in helping folks move to a better life. Angel Stedman of the Salvation Army and Derek Boulware of Housing First, Inc., the Homeless Coalition, are up first this morning. We'll also talk with Diane McCaskey of Family Promise of Coastal Alabama, Sharon Brammer of Franklin Primary Health Center's Healthcare for the Homeless, and Cherie Archer of Ozanam Charitable Pharmacy. We'll also hear this morning from Mike McKinley of One Meal. Our homeless today on Perspectives. We're back right after a quick break. And we're back on Perspectives on this Sunday morning. And Derek Boulware, he is the Chief Executive Officer of Housing First, Inc., the Homeless Coalition. He joins us, as mentioned this morning, along with Angel Stedman of the Salvation Army of Coastal Alabama. And Angel is the Director of Program Services. Thank you both for joining us this morning.
Thank you.
Thank you for having us.
I think I shared with you, I saw a movie recently, and it really just impacted my heart about the homeless and wondering what things were like in our area, because of course we see our homeless in the area, and we understand some of the problems that Mobile and the water and the tunnel and the bridges presents to some of our people moving to other locations. And so this morning we're going to talk about what's going on, how are we serving, and especially how our different agencies are meeting the needs. When you hear the word homeless in your organization, what does that mean to you? How do you define homeless?
Well, it depends on which funding source we're looking at. So HUD has specific definitions for homelessness. The Mobile County Public School System has its own definition for homelessness. But generally, anyone who doesn't have a fixed permanent resident, somewhere safe and habitable to lay their head down at night, is how I view homelessness.
And from your perspective, Derek?
Yeah, Angel's right. There are all kinds of degrees of homelessness, of what makes up homeless. Veteran homeless, family with children, single unaccompanied adults. It really is almost unlimited from that standpoint. But as she was saying, there are defined definitions for how we go about serving those individuals, like our veterans.
And of course, funding is important as you're meeting those needs to the different men, women, and families now. You've been working with us for nearly 20 years directly with the homeless. Where are we here in this area?
Well, I think that we do a good job at working together. I think that's number one, the most important thing. No one agency can tackle this problem and tackle it successfully. It takes a tremendous amount of resources and a lot of people coming to the table to deal with these issues because they're complex human problems. And usually there's sometimes generations that are experiencing homelessness continuously. So it takes a lot of agencies, a lot of patience, and a lot of resources to serve those that we have.
I know it's hard to paint a broad picture, but who are you dealing with primarily at the Salvation Army?
At the Salvation Army, we have 2 homeless shelters. One is for families with dependent children. It doesn't matter the makeup of the family, basically families defined by the families we serve. They just have to have dependent children. And then the other is downtown. We serve homeless single men, adult males 19 and older. So there's about 60 beds at the Family Haven. That's the family shelter, and there's about 60 beds for the homeless men downtown.
Of course, the family issue has been something that's not, say, new, but it's something more recent that we're dealing with now here in the nation. Derek, who are you dealing with when you look at the community that you're serving?
Sure. Well, you know, something that Housing First offers, which is the coordinated entry process. So our homeless community would come through Housing First, and there would be an interview done with the individual to decide exactly what level of service they need. And so from that standpoint, we're able to identify percentages of those unaccompanied adults or youth with children, and then we're able to then better serve them, if not through Housing First, through agencies like the Salvation Army or Penelope House and Family Promise, and it goes on and on and on like that. But it's a great way for us to know exactly what our population looks like and to see if we're improving. If Angel and I were talking about earlier, there's a point in time count that's done each year. And the point of that is to go out into the community, both in Mobile and Baldwin County, meet with those individuals that are living homeless, find out exactly who they are, what sort of area they fit into, and so we can better understand from the standpoint of not only service, but funding for those groups.
Is our population growing, or how do you assess that?
Well, we were talking about that earlier as well. So the point in time count that we had, the number has improved in Mobile and Baldwin County over the last year. I will tell you something interesting about some of the statistics. Alabama, over the last 5 years, we've seen a decrease in the total number of homeless by 25%. So it's been a dramatic movement in the right direction. The problem is still growing and is going to continue to be an issue for us as a community to deal with, as Angel rightly said. So I think by the agencies working together as we do, we're in a better position to adjust to whatever changes may come in the future.
That's very great to see the joint efforts, because for some years just one or two out there, and now it is a team effort, so to speak.
Yes, sir, it is. And it also helps that we all use the same database, the same, it's a homeless management information system, which we're all tied to. It's a nationwide database, but it systematically collects the data that we need and really does help us make better informed decisions.
Well, we're going to take a hold on that for a moment. When we come back, we're going to bring in Diane McCaskey of Family Promise of Coastal Alabama. As mentioned, that's one of the partners in the effort. She'll be joining our discussion. But first, we hear from Mike McKinley of One Meal. It's an outreach that started after a chili cook-off 10 years ago. Perspectives continues after this.
On the way home, my normally talkative daughter was quiet and she was a little teary, and when I asked her what was going on, she told me that she didn't know folks had to get in line and had to scrounge and beg for food. So I explained to her a little bit about it, and she said she wanted to come down here and help. So the next day, that was Saturday when it happened, and Sunday we come down there after church and brought some sandwiches and chips and water. You know, went down to Bienville Square and the food ran out real quick, and she wanted to do it again. Well, we haven't, since that, we have never missed a Sunday to coming downtown and serving food. We've grown from doing sandwiches to now we've got full-fledged meals out here, I mean, restaurant style stuff. So, you know, my daughter was 13 when this started.
And welcome back to Perspectives. This morning we're hearing from the folks who serve our homeless. And joining us now to share in the discussion, Diane McCaskey of Family Promise of Coastal Alabama. And Diane is the executive director of the program. Good morning and thanks for joining us.
Good morning.
Of course, Derek Boulware and Angel Stedman here with us still from Salvation Army and Housing Coalition, our Housing First Coalition, Inc. And of course, they both tied in the aspect of team tackling the issue in our area, and most importantly, they also mentioned Family Promise. Tell us, what exactly is Family Promise and how are you a part of this equation?
We are definitely a part of this collaborative effort. It's a shelter that serves families with children. As a matter of fact, it's Mobile's first shelter that served entire families with children in them. There was a time in the past when children who were of a certain age, male boys, were separated from their families. Men would have to go to one shelter and families would go to another one. But as a nation, we decided that that wasn't the best way to offer service. So Family Promise stepped in and we started serving intact families. And we do that in partnership with congregations throughout Mobile County. So we are collaborative partners with our other service agencies and our lead agency at Housing First, but also with thousands of volunteers throughout Mobile County. These folks set up shelter space inside of their worship centers And they do that for a week at a time, and they house 4 families on site. They provide meals, and they spend time with families and play with the kids, and that's how Family Promise takes shape every day of every year.
How did that happen? How were you able to pull these folk to the table to make this type of effort happen?
Well, I think that there is a strong history of service among the faith community here in Mobile. So they were noticing that congregation members and other citizens in our area were coming to them and expressing a need for emergency housing services that we just didn't have at the time. So they kind of got together and tried to figure out, well, what can we do? We don't have the capital maybe to build something from scratch. And so they said, well, let's use what we have. We have space here in our worship centers, and that's how Family Promise came to be across the nation. We're one of 211 affiliates.
How important is it to keep that family together?
It's extremely important, because studies show that when children are rescued from homelessness quicker, they rebound quicker, and the trajectory for their futures are better. So families, when they are able to work together as a family unit and maintain some stability, they're able to move out of homelessness more quickly and provide the life for their children that they want. And we all just want to help parents do that.
Right. And Angel, I'm sure with you having been involved as many years as you have with Salvation Army and the homeless, you've seen a difference with that now being another option to offer.
Absolutely. In fact, one of our shelters was for only single women with young children, and boys couldn't be over the age of 13, and the men were sent to a different shelter. And it was incredibly stressful to break up a family at a time when they're already experiencing a crisis. So 4 years ago, when working with Housing First and our Homeless Coalition, we came together and we completely changed the model of the Family Haven. The other thing that we learned is that we had to offer as many wraparound services as we could, and we had to offer them on site, because a bed and a roof and a meal is the start. It's the most basic, but that's not the work that really gets them out of homelessness. It's really the case management, substance abuse, mental health, employment, parenting, and all of those classes, we are working to provide on site at the Family Haven.
A lot of needs. And Derek, who saw this way of addressing the problem and the importance of addressing this in the nation? Where did this come from?
Well, to speak to the nation, it would be hard to say. I can tell you from Mobile, a man by the name of Dan Williams, many years ago, was instrumental in establishing Housing First, and has gone on to continue to serve in this important cause. Something Angel just said is very true. Case management. We talk about housing, how important it is to take someone from homeless to house, but then what do you do at that point? And I think with all of the agencies, case management is so important so that we have an individual that is able to stand on their own eventually. That's really the ultimate goal, is that they're able to take care of their families, live as productive citizens in Mobile and Baldwin County. And that's really the mission of all of us that are collectively involved with housing the homeless.
What are you hearing from the churches involved? What are they saying about the role they're playing in this now?
They love feeling as though they are carrying out the mission. And I think that many volunteers often say, I realize that there isn't all that much difference between these families and my family. Yeah, so there are often times that kids are they're the same age playing together. They're volunteers' kids, and they're our kids.
How many churches?
We have about 20 partner churches. Yeah.
Looking for more?
Always.
Always. We can always need more volunteers who are part of the effort to make life better for the families. And it's always said that we're all just a few steps away from that could possibly happen to our families.
Without a doubt.
Yes,
We were
definitely.
talking about that just yesterday. The staff and I were about how does someone become homeless? And the thought is, if you think about it, if you remove your wife, your husband, your mom, your dad, your family, your network, and you take those individuals out, it's real easy to see how you are not that far away from anyone that may live on the street at this point. So we're fortunate to have what we have, and we're also tasked with really trying to help those that are less fortunate. And so, again, it's a great way to sort of put yourself in that perspective. How can you relate? Just remove some of the people you depend on every day.
That's right, those support systems. We thank the three of you for being a part of this morning, and we'll be posting information so that folks can at home watching this can contact you, and of course, if they want to be a part of the effort to make some things happen for the better in our community, they will be able to do that as well. So we thank the three of you for what you do as well.
Thank you, Eric.
Well, when Perspectives continues this morning, we'll hear from our guests from Franklin Primary Health Centers, Healthcare for the Homeless, and Ozanam Charitable Pharmacy. And Mike McKinley, he takes us to the break again, sharing what One Meal has become in 10 years. We'll be right back.
Me and my family come down here. We've got, as you can see behind us, we've got a bunch of volunteers. We've networked out to where a lot of people come and help us. You know, and it's essential for the community to understand that these folks just need a little help. They're not all bad folks. I mean, and we don't ask them anything. One Meal has one thing. If you're hungry, get in line. We don't need to know why or what or anything. Just come on down here and get you some food and eat. We've had several cases where people have come back down to tell us thank you. They have, with the help of us, they've pulled themselves up off the streets, gotten jobs. We had a couple of fellows 2 weeks ago, I'm sorry, come by and tell me that they bought a house, they've got a truck, they've got jobs. There's two brothers. And, you know, I'm glad to hear that. There's another fellow that, to this day, every now and then, he'll send us a little donation because we helped him for so long. And now he sends to pay us back because he's working, got a job. Got another fella, ate with us for about 1.5 years or so. He has his own business now, and his family, he's got his family off the street. They've got him a house trailer on their own land and everything. So, yeah, there's a difference. Sometimes the folks just need just a little help, you know.
Welcome back to Perspectives this morning, and here with us now to share why health care is a very important part of serving the homeless as well as about their organizations. Sharon Brammer, Program Manager of the Franklin Primary Health Center's Healthcare for the Homeless. Right. And of course, Cherie Archer, Executive Director of Ozanam Charitable Pharmacy. Ladies, thanks for joining us.
Thank you for having us.
Well, we got a chance to hear about the team effort that's taking place, the different organizations working together, and they also shared about the importance of health in the equation for the case manager to have a way to look at how can we meet the different needs. What have you seen working through Franklin with the homeless community and the needs for services you provide?
Well, I have been at Franklin Healthcare for the Homeless for 15 years, and so we are part of a medical home. We provide a medical home with patient-centered health care, and I like to always think that I am providing people who are homeless, not homeless people. And the respect and the care that I'm able to give them, the medications through Ozanam, that's not a worry. You know, we can almost always get any medicines that they need, either through Ozanam, patient assistance programs, but the challenges that people who are homeless face are much greater than their medication needs. A diabetic who has nowhere to store their insulin. A patient who has congestive heart failure who's on a diuretic says, I can't take my medicine because I have nowhere to go to the restroom. So it's things that we take so for granted,
that's
that
right.
Dictates how I have to deliver health care.
Sharon mentioned the aspect of medication being available.
Right.
That's something that, you know, we don't think about because everything is usually in the reach of our hands. So how did that organization come together to see the need to provide the medication?
Well, 14 individuals got together 21 years ago, and they were doing assessment on seniors, and 21 years ago Part D didn't exist. So they got together and said, let's form a free pharmacy to provide medication to seniors. And so then Part D came about, and we expanded our services to include adult individuals who are uninsured, living in a certain income level, and we provide the medications to 19 and up. So today we provide the medications to 1,690 patients. And we're talking millions of dollars, close to $3 million worth of medication last year. That's $3 million that those patients would have had to pay in a retail pharmacy.
And of that, you've served a lot of homeless as well as a lot of six figures when we
Right.
talk about the amount. Share that with us.
About a third of our patients are homeless. We share mutually 370 patients who are homeless. And those patients obtain medications like, for diabetes. For example, a diabetic patient, once Sharon's given them the diagnosis of type 2 diabetes and prescribes them a long-acting medication and a short-acting. Long-acting to maintain the blood sugar level, a short-acting to take when they're eating. That medication, if it's a Tresiba, would cost about $600 for a 30-day supply. In addition to that medication, for the short-acting so that they can eat, that would cost another $500. And so nobody, even making a good salary, would be able to afford that. Well, at Ozanon, we're able to provide that at no cost. That's why we maintain a free pharmacy, because they've, spent their money everywhere else for food.
Trying to survive.
Trying
on
to
the other
survive.
things that are needed.
Right.
Sharon, how do they find out about what you're offering at Franklin? Is this something that, of course, we know the other agencies are out there, but how does someone know that?
I think it's probably word of mouth. There's a pretty tight community with the homeless. They look out for each other. There's a social order. And if they know that there's somebody that's sick, they know how to get them to us, and they know how to call us. And we provide transportation, so if there's a person who needs to be transported to us, we transport them to get to Ozanam to get their medication. So I would say that's probably the best way. We're part of the yearly health. It slips my mind
That's
now.
okay. Assessment of
Yes,
right.
and so we meet a lot of people that way, and we have health fairs. We go into the shelters.
How did Franklin decide to do this? Because, of course, Franklin, like Ozanam, were providing services for lower income people. How did they decide to move in this direction?
Well, we're grant funded, and I happen to work for a wonderful man named Charles White, and he has a passion for helping the homeless, and there became a federal grant that was available in 1991. He applied for that grant, and that's how we are able to provide health care.
Do you need contributions to provide assistance and support?
You hear about medications and the price of medications every day. We actually have to purchase over $107,000 worth of generic medications every year. So, we are a homegrown, home-built organization. So we rely on the community to help us to provide that medication.
And of course, what about Franklin? Do you all take contributions?
Absolutely, because there's some things that our grant doesn't cover. Like a person, I can see a person who may be ready to go to work. They have no steel-toed boots. They can't go to work until they get simple things like that. They can't work without it. And so having a fund that we're able to use to do things like that, to get a person a bus pass that maybe got stranded here in Mobile, and we're able to get them on a bus to go home. I mean, those are the kind of things that we need the funding for.
Well, ladies, we thank you both for being a part and sharing this morning. And of course, this is information that will be available on our website for our viewers. We'll be posting all of this from all of our guests today. Just search for Perspectives and Homeless at fox10tv.com or on the Fox 10 News YouTube page. Of course, join us here next Sunday morning at 7:30 for Perspectives as we continue to discuss important issues and seek solutions. If you have any ideas of topics you'd like for us to address, drop it to us here at Perspectives at fox10tv.com. Again, we thank all of our guests today, and we thank you. I'm Eric Reynolds. Have a great week.